COVID-19 vaccination. Information for people with disabilities and their care providers. COVID-19 vaccines help protect you from getting COVID-19. Millions of people in the U.S. have received COVID-19 vaccines in recent months. COVID-19 vaccines are safe and effective. CDC recommends that people with disabilities get a COVID-19 vaccine as soon as it is available to them. Having a disability alone does not mean someone is at higher risk of getting COVID-19. However, many people with disabilities have certain health conditions that can place them at higher risk of getting very sick from COVID-19. Some of these conditions are obesity, diabetes, cancer, and heart disease. In addition, someone may be at higher risk because of where they live, such as a group home or long-term care home. People might also be at higher risk if they are in close contact with care providers or if they have difficulty following prevention recommendations, like wearing a mask, staying at least 6 feet away from others, avoiding crowds or poorly ventilated spaces, and washing their hands. Talk to your doctor about your health conditions that might put you at higher risk for getting very sick from COVID-19 and about getting a COVID-19 vaccine. When to get your COVID-19 vaccine. It is important that people with disabilities get a COVID-19 vaccine as soon as it is available to them. You or your care provider can contact your state health department to ask about when the vaccine will be available to you and how to sign up for an appointment to be vaccinated. Getting the vaccine. When you go to get your vaccine, be sure to follow all prevention recommendations, like wearing a mask, staying at least 6 feet away from others, avoiding crowds or poorly ventilated spaces, and washing your hands. After getting a COVID-19 vaccine, you should receive a vaccination record card that tells you what vaccine you received, the date you received it, and where you received it. All people who get a COVID-19 vaccine will be monitored on site for 15 minutes after receiving the vaccine. Some COVID-19 vaccines require 2 doses. If a second shot is needed, make an appointment for the appropriate date and time. For scheduling assistance, contact the location that set up your first appointment or call your local health department. If you have a caregiver, this person might be able to help you schedule your appointment. What to expect after your vaccination. COVID-19 vaccines commonly cause symptoms like pain, redness or swelling at the injection site, fever, chills, tiredness, or headache. These side effects may affect your ability to do daily activities, but should go away in a few days. Contact your doctor if your side effects are worrying you or do not seem to be going away after a few days. And even after you are vaccinated, follow current CDC and Health Department guidelines on wearing a mask, physical distancing, avoiding crowds and poorly ventilated spaces, and washing your hands often. For more information, CDC has resources available on COVID-19 and COVID-19 vaccines that are easy to read for people with limited English and in American Sign Language. There are also resources in other formats like Braille. For more ASL videos, go to CDC's YouTube channel. For the latest information, visit cdc.gov/coronavirus.